Welcome to my video documenting a few of the tricks that I used when I had a little bursitis of my left knee. So your bursa sac, which you have multiple of them in different joint spaces in the body, will occasionally be exposed to some sort of trauma. And if it does decide it wants to burst, then you will get a lot of swelling. So the first thing you always want to do for swelling is to elevate. So I spent a lot of time in restorative postures because standing was pretty painful. Walking was difficult because the swelling reduced the mobility in the knee. So of course the first thing you want to do here is just practice learning how to be still. To get the swelling down, occasionally, this is what they use for people who've had knee replacement surgery. They make socks that go around the entire leg, but really all you need is a pair of tight pants, tight leggings. Like these aren't even quite tight enough. You need a particular material that isn't super stretchy. And it will help disseminate the fluid throughout the knee space and onward, and it can create a lot of relief. I found that I could move more when I had certain pants on as opposed to others, right? But the first thing you can do here besides relax is also to sort of move things around and create a sense of a sense of jello in your legs. And the breathing is important, so be sure that you're exhaling all the way. A lot of people think you have to put effort into your inhale, and the effort really occurs almost more on the exhale. And there's reasons for that. Air pressure compared from between the outside of our body as opposed to the inside of our body differs in such a way that the air enters us, which is why when we're in higher climates, the air is quote-unquote thinner, and so it's harder to breathe because the difference between the pressure in our lungs and outside are a little bit closer to one another, and so the heavy pressure always feels compelled to go into low pressure areas. So that's sort of a brief explanation. So make sure you're exhaling all the way, and this will create a response in the body that hopefully triggers your rest or digest. So if you're always stressed, and breathing can induce this, among other things, if you're always stressed, you're not going to heal, at least not very quickly. So just spending about 10 or 15 minutes a day with whatever ailment you're experiencing in your lower extremities and just breathing. So we're going to count. I'll do this 10 times with you, and then you can either pause the video and continue, or we'll switch what we're doing together. So as you inhale, we'll take a count of 2 to start. Inhale, and then exhale 3. So we'll count like this. Inhale, exhale 3. Inhale, exhale 3. 1, 2, 1, 2, 3. 1, 2, 1, 2, 3. 1, 2, 1, 2, 3. 1, 2, 1, 2, 3. 1, 2, 1, 2, 3. 1, 2, 1, 2, 3. 1, 2, 1, 2, 3. 1, 2, 1, 2, 3. Breathe on your own without counting the in and out. See if your body has acclimated to the rhythm without having to count numbers. And then when we want to get up, pause the video if you're going to stick around a little bit more. We'll take the feet towards the bolster, turning around, let your head relax, and then come up. The tennis ball. So you can use a tennis ball and or a yoga block. And depending on which side the bursitis is bothering you, I'm just going to pretend like I still have it in my left knee. So I'll be tender with the left side. We're going to take some pressure off the muscles that might be sort of freaking out about what's going on in the knee. Also, we might be overusing these muscles now because we have to walk differently and compensate for the pain and the stiffness. So what you may or may not see is the ball is in between, and I was just taking it based on what I could handle in terms of pain sensation, and you can just roll it around with the top leg. And whether or not you feel a lot going on, trust me, there's stuff going on here. And you can use the top leg in different ways, and perhaps even the hand. The thing about the hand, though, is you actually have to put pressure on it, and the idea would be to use a more natural weight. This is just the weight of my leg. Pressure and force are generally not as good when it comes to initiating changes in the muscular structure as leaning in and putting in natural weight distribution, which is very much the principle of like Rolfing and Thai massage, which of course I practice the latter. I do it to people, and it's all about using your body weight correctly. So here we go. You know, I've kind of worked it around a little bit. The other thing you can do, if it's really tender and the rolling is just too much, you can lay down. I'm just going to use this because I want to. You can lay down and just let the natural weight of the leg, and if you want to make things weightier, you know, you have a hand you can put on. You can put on heavy blankets, a sandbag if you have it. I wouldn't have anyone sit on you. Don't even think about that. Probably no more than 10 pounds of weight on here. And then you can move it up and down the inner thigh. And as it goes higher, you're not going to get as much pressure unless the ball can get bigger in some way, like you have a bigger ball. So this is where a harder yoga block can have a more utilitarian role here. As you can see, this is the flat end of the block, so this will create a wider spread of the pressure. You can do something a little bit more pinpointed, but again, this might be too much, especially if your knee is in crisis mode, as in it's just recently been injured. And again, you can see I'm using the leg just to go back and forth really slow. And you can rest the foot on the floor. And then the other thing you want to consider is that the lower leg is also doing a little extra work. So taking the ball and just going back and forth. Now if your leg doesn't straighten because of the swelling for any reason, usually it's more that it can't flex, but nonetheless, if that's the case, then what you might appreciate more is having a block, or you can use a book, some harder books, and just sort of propping it in a spot where maybe you are able to get that edge of pressure into the top of the calf, and then over time you can move the block so the leg is passive, like I'm not actually muscularly doing anything in the leg. and it'll just create a nice sort of flow of the fluid and anything else you believe flows through your body. So, that's if the leg doesn't straighten. You can also do this with a foam roller, but, the roller doesn't really have an edge until you get to the actual end. And then another thing you can do too, take the higher block, roll it around. You can also get yourself a massage in some way, shape, or form. So you're welcome to just take it and rest it. You could have the foot against a wall so you don't have to hold the leg up so much. And just give yourself some time to let the muscles relax, let the fluid dissipate, and allow yourself to relax. And of course you can lay down when you're doing this. So these were my 3 go-to exercises, and the whole time in the background there is an awareness that you're hopefully not breathing through your mouth, hopefully breathing through the nose with an emphasis on a slightly longer exhale, drinking lots of water and trying to get the excess fluid out of you. It was also a very large part of the healing process, and just making sure that you're eating foods that don't exacerbate inflammation in general, like staying away from sugar and dairy, which are notorious culprits of inflammation in even the healthiest of bodies. So I hope that was helpful. Remember, this is not a diagnosis or a treatment plan. This is just sharing my experience with bursitis of the knee, and hoping that you've had a diagnosis and you understand what's going on with you and are following any treatment plans you have gotten, and maybe you try these out and they help you a little bit. All right, see you next time.